Every wrinkle, every small change on the body of an elderly person could be a warning sign that the liver is in trouble. The liver is the body's detoxification factory. But as we get older, its function begins to decline quietly and without warning. What makes this especially dangerous is that many seniors suffer from liver disease without even realizing it, because the symptoms are often subtle and easy to miss. But if you pay close attention, you can actually catch early warning signs just by observing visible changes, like the color of the skin, the eyes, or how the body responds on a daily basis. In today's video, we are going to explore the signs of liver disease in the elderly that you can detect by yourself at home, things that might seem small but could actually save a life. And this is not just a dry medical lecture. You will also understand why older adults are more likely to develop liver problems, which signs are dangerous, and which ones might be mistaken for normal aging. Everything will be explained clearly and in the most understandable way possible. Before we dive in, go ahead and leave a positive affirmation in the comments as a way to commit to bringing good things into your life. Something like, "I am always healthy, and I listen to my body every day." Or feel free to write any other personal intention that inspires you. And don't forget to like this video and subscribe to the channel so you never miss content like this. Let's build a space full of positive energy where we can grow and live a healthier life every day. Now let's take a closer look at each specific sign of liver disease in older adults. First, unusual abdominal swelling. One of the most visible but also most easily confused signs of liver disease in the elderly is an unusually swollen abdomen. On the surface, ascites and belly fat might look similar, but they actually point to very different health conditions. So how can you tell the difference? A person with belly fat due to being overweight usually has a soft, evenly distributed layer of fat that does not feel tight. In contrast, an abdomen swollen from ascites is round and firm like a balloon. The skin may appear shiny, and you might see visible veins on the surface. It also comes with a feeling of heaviness and discomfort. A distinct sign is that when the person lies on their back, the fluid causes the abdomen to spread outward to the sides. Ascites is closely related to increased pressure in the portal vein system, which is the network of blood vessels that carries blood from the intestines to the liver. When the liver becomes severely scarred or damaged, blood flow gets backed up, increasing the pressure in the portal vein. Over time, plasma leaks into the abdominal cavity, where it accumulates as fluid, leading to the swelling. Ascites not only affects appearance, but also seriously lowers quality of life. Patients often experience shortness of breath due to pressure on the diaphragm, loss of appetite from pressure on the stomach, and difficulty moving around. They may become unsteady and prone to falls, which is especially dangerous for older adults. Second, changes in the fingernails. Most people would not expect that small changes in the fingernails could actually reflect the health of the liver. In seniors, changes in the nails are not only caused by aging, but may also be signs of serious health conditions we should never ignore. 1. Especially telling sign is the appearance of horizontal white lines across the nails, known as Muircher's lines. These are pale white stripes that run parallel to the shape of the nail and often appear on several fingers at once. What makes these lines unique is that if you press gently on the nail, they do not disappear, unlike the more common white spots caused by minor trauma or nutrient deficiencies. These lines develop when there is a drop in blood protein levels, which often happens in people with chronic liver disease, cirrhosis, or nephrotic syndrome. When the liver is weakened, it loses its ability to produce enough albumin, a key protein. As a result, Muircher's lines show up as a silent warning sign. There's another way to tell them apart. If your nails have scattered white spots from minor bumps, those spots will slowly move as the nail grows, but Muircher's lines stay in place and do not move as the nail grows because they come from changes beneath the nail bed rather than on the surface of the nail itself. Third, bulging veins around the navel. This is a condition that can be clearly seen with the naked eye in people with severe liver disease, especially in the advanced stages of cirrhosis. The formation of what is called caput medusae is directly related to increased portal vein pressure. When the liver is damaged and becomes scarred, blood can no longer flow properly through it. the pressure builds up in the portal vein system, forcing the body to find alternative pathways for blood flow. One of those alternative routes is through the veins around the navel, which connect the portal vein system to the systemic venous system. Under high pressure, these veins become enlarged and visibly twisted under the skin, forming the characteristic image known as caput medusae. The name comes from the appearance of these swollen veins radiating from the belly button, which look like the snake hair of Medusa, a figure from Greek mythology. Clinically, caput medusae is not just a warning sign of severe liver disease, but also a red flag for dangerous complications. These swollen and fragile veins can rupture easily, leading to serious internal bleeding. The presence of caput medusae also signals that portal hypertension has reached a dangerously high level, and it is often accompanied by other complications such as ascites, esophageal varices, and severely impaired liver function. Fourth, spider angiomas on the skin. Spider veins, also known as spider angiomas, are clusters of small blood vessels that appear just under the skin. They look like little red spiders with a central red dot and tiny blood vessels spreading outward like legs. This is one of the classic signs that can be seen with the naked eye in people who have liver disease, especially in the cirrhosis stage. Spotting spider angiomas is actually pretty simple. Just press gently on the red center with your finger. If it's a true spider angioma, the surrounding blood vessels will temporarily fade or disappear as the blood is pushed out. Once you release the pressure, the blood rushes back in, and the spider pattern quickly reappears. This helps distinguish them from other random red spots on the skin. From a medical standpoint, the number of spider angiomas matters. If you only see one or two, it might not be a big deal. These can even show up in healthy people, pregnant women, or those who use birth control pills for a long time due to the effects of estrogen. But if you notice more than 3 spider angiomas, especially if they are mostly on the face, neck, chest, or arms, then that's a strong indicator of possible liver disease, and it's a good idea to get checked by a specialist. The reason spider angiomas form is closely tied to hormone imbalances, especially involving estrogen. In chronic liver disease, the liver can no longer remove excess estrogen from the body. When estrogen levels build up in the blood, it causes the tiny blood vessels under the skin to dilate in an unusual way, leading to the spider-like appearance of these veins. Fifth, red palms. The liver plays a key role in processing many substances in the body, including hormones, especially estrogen. Normally, the liver helps break down and clear out extra estrogen from the blood. But when the liver is damaged, like in chronic hepatitis, cirrhosis, or liver failure, its ability to process estrogen becomes impaired. As a result, estrogen starts to build up in the bloodstream. Estrogen causes blood vessels to expand, especially the small capillaries under the skin. When estrogen levels get too high, it causes the blood vessels in the palms to widen, leading to a reddish appearance, particularly around the raised areas of the palm, such as the thenar area at the base of the thumb and the hypothenar area at the base of the pinky. So red palms are actually an indirect sign that the liver's function has declined, and they serve as a warning that the damage may already be serious enough to throw off the entire hormonal balance of the body. Sixth, muscle wasting. One of the easiest places to notice muscle wasting is in the hand, specifically in the space between the thumb and the index finger. In healthy individuals, this area is filled with muscle tissue, making it look full and firm. But when muscle wasting occurs, this gap becomes sunken. The bones of the hand become more visible, and the whole hand looks thin and hollow. Another noticeable spot is the temple area on both sides of the forehead. When the muscles there shrink, the face takes on a sunken, tired appearance. The root cause of muscle wasting in liver disease is the liver's loss of ability to produce and store proteins. Under normal conditions, the liver plays a central role in metabolizing and storing protein and essential nutrients. But when it is severely damaged, its ability to produce proteins, especially albumin, declines sharply. At that point, the body starts running low on both energy and protein. To compensate, it begins breaking down its own muscle mass to release amino acids, which are then used as fuel for vital organs. Over time, this leads to a decrease in muscle volume and muscle wasting, especially noticeable in smaller muscle groups. Muscle wasting does not just affect appearance. It has serious health consequences, especially in older adults. Loss of muscle mass leads to weaker strength, reduced mobility, difficulty, walking, loss of balance, and a higher risk of falls. And for seniors, a fall can lead to broken bones or even be life-threatening. Beyond that, muscle wasting lowers a person's ability to care for themselves, reduces overall quality of life, and worsens malnutrition. This makes recovery from liver disease much harder and slower. 7th, sweet, musty-smelling breath. A sweet but musty or mildly rotten fruit smell on the breath can appear in people with severe liver disease. This is one of the most distinctive and important signs that the liver's function is seriously declining even before other dangerous complications show up. Identifying bad breath caused by liver failure is actually pretty straightforward. The person experiencing it or their loved ones can usually detect it just by smelling their breath, especially in the early morning before eating or drinking anything. The smell is very specific. It has a slightly sweet but unpleasant odor similar to rotting fruit or a damp, moldy scent. It is completely different from the usual bad breath caused by gum disease or poor oral hygiene. The underlying cause of this smell is the liver's inability to filter toxins from the blood. Normally, the liver detoxifies and removes compounds, such as dimethyl sulfide, a volatile substance with a very strong and recognizable odor, along with other metabolic waste products. When the liver is severely damaged, these substances start to build up in the bloodstream and are eventually released through the lungs, giving the breath its unusual smell. This buildup of toxins does more than just affect the breath. It also signals a serious breakdown in the body's overall metabolic processes. The condition is known as feta hepaticus and usually appears in late-stage cirrhosis, advanced chronic hepatitis, or hepatic coma, which is a life-threatening emergency. So if someone has sweet, musty-smelling breath, it should be taken as a major red flag. It means the liver can no longer properly filter the blood and urgent medical attention is needed. If this sign is accompanied by other symptoms like jaundice, an abnormally swollen belly spider veins, or changes in mental clarity, the risk of dangerous complications is already very high. 8th, yellow skin and eyes. Yellowing of the skin and the whites of the eyes, commonly known as jaundice in medical terms, is one of the easiest liver-related symptoms to detect with the naked eye. And this is not just a cosmetic change. It is a loud and clear warning that the liver may be in serious trouble. Jaundice occurs when there is an excessive buildup of bilirubin in the blood. Bilirubin is a yellow-orange pigment that is produced when old red blood cells are broken down. Normally, the liver processes and removes bilirubin from the body through bile, but when the liver is weakened, damaged, or when the bile ducts are blocked, the body cannot clear out bilirubin effectively. It begins to accumulate in the blood and eventually gets deposited in the tissues, causing the skin and eyes to turn yellow. The best way to detect jaundice is to observe the skin and eyes under natural light. Sunlight makes the yellow tint easier to spot, especially in the sclera, the whites of the eyes, which is usually the first and most noticeable place the yellowing appears. The entire skin may also take on a yellow hue, ranging from a light tinge to a more obvious deep yellow, depending on how much bilirubin has built up in the blood. In addition to the skin and eyes, urine color is another important clue to assess the severity of jaundice. As bilirubin levels rise, the urine may turn from dark yellow to a deep brown like strong tea. This is a strong indication that the liver is failing to eliminate waste products as it normally would. It is important to understand that jaundice is not just a matter of appearance. It is a clear symptom of serious liver conditions, such as acute hepatitis, cirrhosis, liver cancer, or bile duct obstruction caused by stones or tumors. The more intense the yellowing, the more severe the liver damage or bile blockage is likely to be. If not detected and treated promptly, jaundice can lead to dangerous complications, like liver failure, blood clotting disorders, or even death. After identifying early warning signs of liver disease, taking proactive steps to care for and protect the liver, especially in older adults, is absolutely essential for maintaining overall health and preventing complications. 1. A balanced and healthy diet. A well-balanced diet plays a critical role in keeping the liver healthy, especially for seniors. It is important to limit the consumption of foods high in fat, especially animal fat and fried or greasy dishes. Saturated fats increase the liver's metabolic workload, forcing it to work overtime. Over time, this can lead to fat buildup in the liver and chronic inflammation. Instead, the diet should focus more on leafy green vegetables, fresh fruits, whole grains, and nuts. These foods are rich in fiber, essential vitamins, and minerals. Not only do they support the liver in detoxifying the body more efficiently, but they also help maintain a healthy weight and promote stable metabolism. Another crucial point is to minimize alcohol consumption. Alcohol is one of the leading causes of hepatitis, cirrhosis, and even liver cancer. What is especially concerning is that alcohol-related damage can accumulate quietly in the body, even when consumed in small amounts over a long period of time. For that reason, either avoiding alcohol completely or drinking only at the most minimal level is one of the best ways to protect the liver and extend life expectancy. 2. Managing blood sugar and blood lipids. Diabetes and high cholesterol are two major risk factors that contribute to the progression of fatty liver disease, cirrhosis, and liver failure. When blood sugar or blood fat levels stay elevated over time, not only do they put strain on the heart and blood vessels, but they also add to the metabolic burden on the liver, gradually damaging liver cells. That is why, for older adults, closely monitoring blood sugar and cholesterol levels is extremely important. The goal is to maintain steady blood sugar levels and lower the levels of bad cholesterol, also known as LDL cholesterol. To achieve this, it is important to follow a healthy diet, cut back on refined sugars, reduce saturated fat, and prioritize fiber-rich foods and healthy fats from sources like fish, avocados, and nuts. At the same time, regular physical activity is essential. Gentle exercises such as brisk walking, yoga, or swimming should be done consistently and adjusted to match a person's physical condition. In particular, medications used to control blood sugar and cholesterol should always be taken exactly as prescribed by a doctor. Never adjust the dose on your own, as proper medication use is key to keeping these levels in check and minimizing the risk of chronic liver damage. 3. Full vaccination against hepatitis. Viral hepatitis, especially hepatitis B and hepatitis C, is one of the leading causes of chronic liver disease, including cirrhosis and liver cancer. These diseases often develop silently over many years without showing clear symptoms, which makes prevention especially important for older adults. To effectively protect the liver, seniors should get fully vaccinated against hepatitis B, especially if tests show they do not have natural immunity or if they have never received the vaccine before. The hepatitis B vaccine is highly effective at preventing infection and significantly lowers the risk of developing serious liver disease. In addition to vaccination, it is important to practice safe habits to prevent infection. Never share needles, razors, toothbrushes, or any other personal items that could cause skin injury and bleeding. 4. Regular checkups with a digestive and liver specialist. The liver is often called a silent organ because when problems arise, they rarely show clear symptoms in the early stages. Many liver diseases are only detected after they have already progressed to a more advanced stage, which makes treatment more difficult and the prognosis less favorable. That is why having regular checkups with a digestive and liver specialist at least once or twice a year is extremely important, even if older adults do not notice any unusual symptoms. During these appointments, doctors will perform tests to assess liver function, such as checking liver enzymes ALT and AST, bilirubin, and albumin levels. They will also use abdominal ultrasound imaging to look for early signs of liver tissue damage, structural changes, or abnormal growths like tumors. The liver may be silent, but it plays an incredibly important role in overall health, especially for older adults. Small signs like yellowing of the skin, unusual abdominal swelling, red palms, or a strange odor on the breath could all be quiet warnings that the liver is in trouble. Recognizing these symptoms early, combined with a healthy diet, good blood sugar and cholesterol control, full vaccination, and regular health screenings, is the key to maintaining a healthy liver, living longer, and improving quality of life. Before we wrap up, feel free to leave a positive comment below as a commitment to taking better care of your health. Something like, "I love and appreciate my body," or any other affirmation that inspires you. And do not forget to like this video and subscribe to the channel so you never miss more valuable information about senior health. Let us build a positive, supportive community where everyone lives healthier and happier every day.